Most people assume a heart attack is going to announce itself. Sudden, crushing pain in the chest, the left arm going numb, someone gripping their shirt and dropping to a knee. That is what film and television show, and that is what most adults expect to see when they imagine a cardiac event. After 60, the most dangerous events are not those. They are the quiet ones, the ones that build slowly during sleep. No warning shot, no window of time to dial for help, no second chance, and here is what almost always startles my patients when I sit with them in the recovery room. Those silent overnight events are nearly always set in motion by something completely ordinary. Something so unremarkable you wouldn't even mention it. Something you did before you turned off the light. I'm Dr. Emily Chen. I have spent more than 2 decades immersed in cardiology, reviewing the trials, sitting in on cases, watching patients move from compensated to decompensated and back. Over that time, I have watched the same preventable patterns play out again and again in adults who had genuinely no idea what they were doing to themselves every single night. Tonight, I want to walk you through 6 of those patterns. 6 evening habits that are quietly setting your heart up for trouble while you sleep. And then I'll show you, step by step, exactly how to diffuse each one. Starting tonight, in your own home, with no new prescriptions and no special equipment. Stay with me. What you learn over the next several minutes may very well be the most important thing you take in this year. Here is something almost no one is told. Your cardiovascular system does not clock out the moment you fall asleep. It changes gears. In a healthy adult, the night is when blood pressure naturally drifts downward, usually about 10 to 20% lower than your daytime reading. Heart rate slows. Arteries relax. The whole system enters what is essentially a maintenance window. Your body has been doing this for you every single night since you were born. After 60, that nightly maintenance window becomes less reliable. The walls of the blood vessels stiffen. The fine-tuning that controls overnight blood pressure becomes less precise. Several hormonal signals that used to protect the heart through the night start to fade, and the margin for error narrows considerably. Think of it like this. During the day, your cardiovascular system has redundancy. It can compensate. It can adapt on the fly. At night, many of those backup mechanisms are simply offline. Your body is operating with a much smaller crew. That is what makes overnight different after 60. That is also why the hours between roughly midnight and 6 in the morning carry the highest cardiovascular risk for older adults. Not the late afternoon, not the morning rush, but the quiet hours, when no one is watching but your habits are still in charge. And here is the part that genuinely changes the game. What unfolds during those high-risk hours is largely determined by what you did in the hours before bed. The meal you ate, the pill you swallowed or skipped, the temperature of your room, the glass of water you didn't drink, decisions that felt completely routine. That is what we are going to walk through right now, starting with the habit my patients are most often guilty of without realizing it. Habit 1. A heavy late dinner. Habit number 1. Let me ask you something. What time did you sit down for dinner last night, and what was on the plate? I ask every patient that question. For a surprising number of adults over 60, the answer is somewhere between 8 and 9 in the evening, sometimes 10. A real meal, pasta, rice, meat, maybe something fried. Then the couch for an hour, then bed. I understand exactly how it happens. Busy days, family schedules, habits built over decades. But from a cardiac standpoint, eating a substantial meal that close to sleep is one of the most underestimated stresses your heart faces. Here is what is happening inside you. When you eat a heavy meal, the digestive system requires a sharp jump in blood flow. The heart pumps harder. Blood pressure climbs. The triglycerides circulating in your bloodstream rise sharply over the 2 to 4 hours after eating. Now imagine layering all of that on top of going to bed. Your body is supposed to be settling down. Instead, your heart is being asked to work overtime to digest a full dinner while at the same time trying to shift into its nighttime recovery mode. Those two demands are in direct conflict. In an adult over 60 with any degree of arterial stiffness, that conflict has real consequences. Studies have repeatedly shown that eating within 2 to 3 hours of going to sleep is associated with elevated nighttime blood pressure, higher rates of acid reflux that can mimic and even trigger cardiac symptoms, and an increased risk of cardiovascular events during sleep. The fix is not complicated. Finish your main meal by 6 or 7 in the evening. If you have to eat later, keep it light. Protein and vegetables, not heavy fats and refined carbs. Be honest with yourself for a moment. Does your dinner schedule look anything like what I just described? You'd be surprised how many adults answer yes and never connected it to their heart. Habit 2. Alcohol within 3 hours of bedtime. Habit number 2 is one many people raise their hand to defend before I have even finished the sentence. The single glass of wine in the evening, the beer alongside dinner, the nightcap that has been part of the routine for 30 years. I am not here to tell you alcohol is universally bad. The cardiology literature on moderate drinking is honestly more complicated than the headlines make it sound. What I can tell you very directly is this. Even one drink consumed in the few hours right before bed produces measurable, unfavorable effects on the overnight cardiovascular system after 60. Here is what alcohol actually does once it enters the bloodstream that close to bedtime. The first effect, the one most drinkers notice and enjoy, is mild vasodilation. The vessels relax. Pressure drops a little. You feel warm and loose. That effect, though, is short. As your liver metabolizes the alcohol over the next few hours, your body swings into a rebound state. Sympathetic nervous system activity climbs, heart rate rises, and blood pressure overshoots upward. That swing is the exact opposite of the protective overnight dip we keep coming back to in this video. There is also a second problem most adults do not realize. Alcohol within a few hours of sleep meaningfully raises the risk of atrial fibrillation episodes, those irregular heart rhythms that come and go, often without symptoms, and that substantially raise stroke risk. Cardiologists have for years called this pattern holiday heart because of how often it surfaces after weekend social drinking. After 60, the threshold for triggering it drops considerably. It does not take much. Alcohol within the bedtime window also makes any underlying sleep apnea worse. It relaxes the upper airway muscles that were already prone to collapse, which deepens the oxygen drops, which kicks the overnight adrenaline and cortisol cycle even harder, which drives blood pressure higher still. The whole pattern compounds on itself. The fix here is not abstinence, it is timing. If you choose to have a drink, give yourself at least 3 to 4 hours between the last sip and the moment you turn off the light. That window lets the metabolic activity settle before you ask your cardiovascular system to begin its overnight repair phase. Keep the portion modest as well. Roughly 1 drink for women, 1 to 2 for men on the days you do drink. The cardiac research is clear that nightcaps inside that 3-hour window produce the largest cardiac downside for the smallest perceived benefit. Habit 3. Wrong timing on your blood pressure medication. Habit number 3 is one I need you to take seriously because this is where the most preventable damage happens. If you are over 60 and you take medication for blood pressure, and statistically, more than half of all adults in that age group do, the timing of when you take that medication matters far more than most appointments allow time to explain. For most people, blood pressure follows a predictable rhythm across the day. It climbs in the morning, peaks somewhere in the afternoon, and dips overnight. But a meaningful share of adults over 60, particularly those with hypertension, do not get that nighttime dip. Their pressure stays elevated through the night, or it actively surges during the early morning hours. The clinical name is nocturnal hypertension. Most patients I see have never heard of it, and it is dangerous in ways daytime hypertension is not. While you are asleep, the arterial walls are not braced for a sudden pressure spike. A surge at 3 in the morning hits those walls very differently than the same surge at 3 in the afternoon. It is more likely to rupture a vulnerable plaque inside a coronary artery, more likely to set off clot formation, more likely to send someone to a cath lab or to a surgeon's table before sunrise. If you take your blood pressure medication only in the morning, it may be wearing off precisely when you most need it to be working. If you forget the dose, you may be leaving yourself completely exposed during the most vulnerable hours of your day. What should you do? Have a specific conversation with your prescribing physician about timing. Ask whether your blood pressure medication should be taken at night rather than in the morning. The conversation takes 2 minutes. It could save your life. The Hygia chronotherapy trial, a large randomized study published in the European Heart Journal, found that taking at least one antihypertensive medication at bedtime versus all of them in the morning significantly reduced cardiovascular risk over multiple years of follow-up. That is not a small adjustment. That is a potentially life-changing conversation, and most adults over 60 have never had it. Habit 4. Untreated sleep apnea. Habit number 4 is something many of my patients walk in the door already half aware of, but never really acted on. I want you to picture someone you know who snores. A spouse. A parent. Maybe yourself. That harsh, uneven rasp that fills the bedroom through the night. Most people treat snoring as an annoyance, something to elbow your partner over and laugh about in the morning. I treat it as a cardiac warning sign until something else proves it isn't. After 2 decades watching this play out, I mean that in the most literal sense. Sleep apnea is one of the most underdiagnosed conditions I see in adults over 60. Roughly 3 in 10 older adults have some form of it, and the vast majority have never been formally diagnosed or treated. They have no idea what is happening to their heart night after night. Here is what an apnea episode is doing inside the body. Your breathing stops for 10 seconds, 30 seconds, sometimes longer. It can repeat dozens of times an hour. Each time, the oxygen level in your blood drops sharply. The brain registers the drop as a crisis and fires off a stress response. Adrenaline, cortisol, a jolt of heart rate and blood pressure. Your heart wakes up, in essence, while the rest of you stays asleep. Night after night, year after year. Now imagine that pattern repeating 30, 40, 50 times in a single night. The cardiovascular consequences are not subtle. Untreated obstructive sleep apnea is associated with roughly 3 times the risk of heart attack. It is a major driver of atrial fibrillation, which itself raises stroke risk dramatically. It accelerates the stiffening and thickening of arterial walls. And because the person is asleep through every episode, they often have no idea anything is wrong until something serious happens. The warning signs are not always loud. Yes, heavy snoring is one. But also, waking up with a headache, feeling exhausted after a full night of sleep, getting up multiple times to urinate during the night, waking with a dry mouth or a feeling of choking. If any of those describe you, ask your doctor about a sleep study. Here is what I tell my patients in plain language. If you snore heavily, you are over 60, and you have any history of heart disease or stroke, getting evaluated for sleep apnea is not optional. It is part of cardiac care. The standard treatment, most often a CPAP device, is not glamorous. I know. But the data on what consistent CPAP use does for the heart is genuinely remarkable. Lower blood pressure, fewer atrial fibrillation episodes, significantly reduced cardiovascular risk. One device, one habit, substantial protection. Has anyone in your household ever told you that you stop breathing in your sleep? Take that question seriously before you scroll past this section. Habit 5. Going to bed dehydrated. Habit number 5 is one driven by completely understandable logic, and that is exactly what makes it so easy to miss. A lot of adults over 60 deliberately limit fluids in the evening. The reasoning is sensible on its face. They don't want to wake at 2 in the morning to use the bathroom. Disrupted sleep is uncomfortable. Getting up at night raises fall risk, so they stop drinking water after dinner, sometimes after 4 in the afternoon. I get it. From a purely cardiovascular perspective, however, going to bed even mildly dehydrated is a meaningful risk factor that almost nobody talks about. When you are dehydrated, your blood becomes thicker, more viscous. It does not flow as freely through your vessels. In a younger cardiovascular system, that is a manageable inconvenience. In a body over 60, navigating arterial stiffness and possibly some plaque, the picture changes considerably. Thick blood moves slowly through already narrowed arteries. It is more likely to form clots. And here is the timing piece most people don't think through. During sleep, your heart rate naturally slows. Blood already moves more sluggishly through the system. Now combine slow circulation with thicker blood in a body that has been still for 7 or 8 hours, in arteries that may already be partially narrowed. That combination, dehydration, slow heart rate, immobility, vessel disease, is one of the reasons heart attacks and strokes cluster in the early morning hours. The fix is genuinely simple. Drink 1 full glass of water, about 8 ounces, before bed. Not a flood, just enough to keep your blood from thickening overnight. Keep a second glass on your nightstand for the moment of mild thirst at 2 in the morning. That little flicker of thirst is your body asking for something your heart also needs. You do not have to choose between sleep and cardiovascular protection. Habit 6. A bedroom. Outside the cardiac sweet spot. Habit number 6 surprises almost every patient I bring it up with because it sounds far too simple to matter. What temperature is your bedroom set to overnight? Most adults have never thought about it as a cardiovascular question at all. They think about it as a comfort question. Preference, season, what your partner likes. But there is a specific range your cardiovascular system genuinely prefers, and outside of that range, your heart is quietly working harder than it needs to be every night. Start with too warm. When the bedroom climbs much above 22 degrees Celsius, about 72 Fahrenheit, your body has to work to dissipate the extra heat through the night. Blood vessels dilate. Heart rate stays elevated. Sweating accelerates fluid loss, which loops you right back into the dehydration problem we just covered. Critically, the depth and quality of your sleep also drops. You spend less time in the slow wave stages where the heart does its best overnight recovery. Now, the opposite extreme. A genuinely cold bedroom, below 16 or 17 degrees Celsius, creates a completely different kind of strain. Cold triggers vasoconstriction. Vessels tighten to preserve core body temperature. Blood pressure rises. The heart pushes against more resistance. For someone with existing coronary artery disease or hypertension, that overnight pressure climb is far from trivial. The sweet spot for both sleep and cardiovascular protection is roughly between 18 and 22 degrees Celsius, 65 to 72 Fahrenheit. That window keeps the body in thermoneutral territory. Vessels relaxed, heart rate steady, sleep deeper. One thermostat setting, real protection. The heart-safe evening routine. Everything I just walked you through might sound on first listen like a long list of things to worry about. I want to flip that for you because when you put all 5 together, what you actually have is a blueprint. A simple, practical evening routine that addresses every single one. I call it the heart-safe evening. It fits into normal life with very little fuss. Here is what it looks like in clock time. Between 6 and 7 in the evening, your dinner window. Lean protein, plenty of vegetables, a moderate portion of carbohydrates if you need them. Not a feast, not a fast. A proper dinner at a sane hour, giving your heart 3 to 4 full hours to settle before sleep. Around 7. Water and any evening medications. If your doctor has not specifically discussed the timing of your blood pressure medication with you, this is your reminder to put that conversation on the calendar. Evening dosing may be substantially more protective. Take that question seriously. Between 8 and 9, your wind down. A short walk if your knees will allow it. A book. A quiet conversation. This is the time to step away from screens, especially the bright screen of a phone, which suppresses melatonin and keeps the nervous system alert long after it should have started settling. By 9, prepare the bedroom, adjust the thermostat, crack a window briefly if you've had it closed all day, set a glass of water on the nightstand. These 3 steps take 90 seconds. They matter. By 10, you're in bed. And one final piece that costs nothing at all. If you snore, or if you have ever been told you stop breathing during sleep, try sleeping on your side rather than your back. Back sleeping dramatically worsens airway obstruction. A simple positional change can reduce apnea episodes meaningfully while you work toward a formal evaluation. Dinner by 7. Water and medications by 7. A quiet evening until 9. Bedroom prepared by 9, in bed by 10, on your side. None of that is dramatic. None of it requires a prescription. And the question is never whether the routine works. The data is clear that it does. The only question is whether you will actually do it. That part is yours. I want to be completely honest with you for a moment, not as someone making a video, as a clinician who has watched this play out. I have stood next to operating tables at 3 in the morning while a colleague held a heart that had stopped because of a clot that formed overnight inside a narrowed artery. I have sat with families in waiting rooms at dawn, families who had no idea anything was wrong when they kissed their husband or wife or father goodnight a few hours earlier. I have read autopsy reports on people who had been planning grandchildren's birthdays the week before. And in case after case, the contributing factors were not exotic. They were not rare. They were a heavy late dinner, a skipped or mistimed medication, a bedroom that was too warm, a body that quietly went to bed dehydrated, an airway that had been collapsing silently for years while everyone in the household assumed the snoring was just noise. These risk factors are the background hum of millions of perfectly ordinary evenings. Stacked night after night, year after year, that background hum can become a cardiac event nobody saw coming because nobody knew to look. The honest takeaway from 20 years close to this work is this. Most of the hearts that fail in older adults do not fail because of misfortune. They fail because the patient was never handed the right information in the first place. Information the patient, frankly, never had. You now have it. The question is what you do with it tonight. Not next week, not after the next checkup, tonight. Let me bring it together. 6 habits, 6 fixes. I want you walking away with a clear plan, not a vague sense of unease. 1. Finish your main meal by 6 or 7 in the evening. Not a radical diet, just a reasonable dinner at a reasonable hour. 2. Give yourself at least 3 to 4 hours between your last alcoholic drink and lights out. Keep portions modest. Protect the overnight blood pressure dip. 3. Talk to your doctor specifically about the timing of your blood pressure medication. Ask about evening dosing. That single conversation could be the most important medical discussion you have this year. 4. If you snore, if you wake up exhausted, if anyone has ever told you that you stop breathing in your sleep, get evaluated for sleep apnea. After 60, this is not an optional item on the to-do list. 5. Drink a glass of water before bed and keep one on the nightstand. Don't let your blood thicken overnight because you were trying to dodge a bathroom trip. 6. Set your bedroom between 18 and 22 degrees Celsius, 65 to 72 Fahrenheit, one thermostat setting, genuine protection, no cost. Now I'd like you to do something for me. Drop a comment below and tell me honestly, which of these 6 habits do you recognize in yourself? My strong suspicion is that at least 2 or 3 of them hit close to home. You are far from the only one. Most of my patients see themselves on this list. The difference is that you now know what to do. If this video was useful to you, please share it with someone in your life. A spouse, a sibling, a close friend over 60 who has never connected their nightly habits to their heart. Send it to them tonight. Take care of that heart of yours. It has been working for you every single minute of every single night for your entire life. Give it the conditions it actually needs to keep going. One last thing. Everything I have shared here is general medical information based on current cardiovascular research and decades of experience close to the field. None of this is a substitute for your personal medical care. Before you make any change to your medication schedule, especially the timing of a blood pressure pill, please speak with your own physician first. That isn't a legal disclaimer. That is a real piece of advice from someone who genuinely wants you watching this channel 10 years from now. Sleep well. I'll see you on the next video.